Greetings and welcome everyone to today's webinar, Annual Wellness Visit, Maximizing Revenue Generation and Patient Satisfaction. Highbridge is Georgia's health IT center assisting clinicians across the state of Georgia to promote interoperability through the successful use of EHR technology. We partner with various healthcare systems across the state of Georgia, including DCH, GHAN, and many other community and professional partnerships. We are located at Morehouse School of Medicine, National Center for Primary Care. Our executive director is Carmen Hughes, and our executive medical director is Dr. Dominic Mack. I will go ahead and turn it over to our program manager, Phoebe Nelms here at Highbridge.
Thank you so much, Brianna. It is my privilege and pleasure to introduce our audience to our presenters today. We have Mr. Van Willis. He is the CEO and co-founder of PREMEDEX, as well as Jim Bowling. He's also COO and CSO co-founder of PREMEDEX. We're really glad that they're going to share this information with our audience today because it is actionable.
Thank you, Phoebe. Thank you, Brianna. As always, we're very proud of the relationship that we have with Highbridge Solutions, and thanks for all the great work you do to support the provider community and allowing us to be included as part of it. Couple of comments about PREMEDEX as we get started, and then I'm going to turn it over to Jim to drill into some of this information about the exciting topics that we have to discuss today. But a little bit about PREMEDEX as we get out of the gate here. We're based in Atlanta as well, and our goal is to really help providers manage and communicate with their patients. And we serve as a seamless extension to the provider offices. We know that providers are extremely busy, and oftentimes new opportunities that come about, implementing new programs that can improve patient outcomes and care, and even drive additional revenues into the practice are very challenging to implement based on how busy the practices are in their current state. And so a lot of what you'll hear about today are new programs that are great for patients. They're also beneficial to thriving practices and can allow great sustainability and thriving through new revenue sources for your practice. So we're excited to talk about those things, and then in the background discuss how we can also help practices should you need some help in executing on these new programs. So let's see here, a couple of other items to discuss here. And I think I'll go ahead and turn it over to my colleague, Jim Bowling.
Great, thanks, Van. And we, as Van mentioned, we appreciate the relationship with Highbridge and the opportunity to present today and tell you about a program that I'm sure you're very familiar with. But what we want to do today is give you our perspective on the program. We've run a lot of annual wellness visit programs on behalf of our clients, and hopefully give you an overview of what it is, what challenges you may face, and some solutions that you can consider in moving forward and how to make it successful. So again, just kind of a quick background on who we are. We help practices and other healthcare organizations drive revenue and scale their operations. So one of the keys here is that we understand that you don't want to have an upfront investment. You don't want additional workload on your plate. You need a solution, and having some folks to serve as extenders to your teams and optimize your objectives in your practices. So TCM, annual wellness, CCM, remote patient monitoring, these are our new bill codes that drive revenue for you. And at PREMEDEX, what we do is we give you the time, technology, and resources to really run these programs efficiently. Just a quick background on some of our clients. We've worked with a lot of leading healthcare organizations around the country. And just want to share with you that these are people who have more than anything helped us refine our programs and make them successful. So I think that's one of the benefits that we can bring. So today we want to focus on annual wellness visits as the title and invitation states there, but we do also want to talk a little bit about transitional care management. That is a key in our company. We think these, transitional care management and annual wellness visits provide key opportunities for practices to engage with patients, either when they're transitioning from acute care environment or during the year. You want to see the patient, get them into the office, and take proactive steps to develop a care plan that can help them. And we've got some data to share with you on how that annual wellness visit does in fact help patients with quality of care and avoiding trips to the ED and hospital. There's some great numbers and stats on that. We also want to talk a little bit about these two areas being key intersections with your patients and where you can onboard them into other value-add programs. So during transitional care or during an annual wellness visit, you can identify patients who are eligible and appropriate for remote patient monitoring, chronic care management, ongoing pharmacy programs. There are a lot of different things that you can help to opt patients into that will drive value for them and for your organization. So we think that is another key benefit to running these programs in your offices. Again, the highlights here, green, are just showing you the two areas that we focus on, discharge and annual wellness. And that's, again, we'll focus over here. But we look at this as a full care cycle, is what we call it. Whether a patient's being discharged from the hospital and we're engaging patients within 48 hours of discharge or 2 business days to meet the TCM requirement, we're working proactively with them in your office. These are 2 opportunities to talk to patients, develop care plans, see if we're on track, and continue to engage them throughout their healthcare journey, no matter where they are. They don't have to be coming in for a sick visit to get great care from you. And during these opportunities, there are many billable codes that we'll talk about that you can take advantage of. The logos you see around the outside here, really, we wanted just to show you. I'm sure that you're getting approached by many different vendors, people who say, we can take care of your medication management for your patients. So we have a telehealth solution or many other solutions that you're being solicited for business and during your day. And we've already developed a lot of relationships with these types of companies and value-add vendors. And so I think that's one of the other great things that we can streamline for you as introducing you to other great vendors during the care cycle that can help impact your business. So we'll, I think for the next few slides, it's pretty text heavy, but I want to give you an overview of the program, the state of the program, kind of where it sits now. It was launched in 2011, and kind of where things are. There's some good and bad things to take away right now, and where the program sits as of today. And then we'll get into some details of what's involved in the program. We'll talk about the codes that you can bill, the reimbursements, and then we'll drill down on some of those, as well as discuss some of the benefits and challenges that you may face, as well as some solutions that you may want to consider. So we'll start with a broader program overview. This program did begin in 2011, and And so there was kind of a quick adoption, the early adopters, and it sort of has leveled off in recent years. And there's some reasons for that we'll talk about. So for an annual wellness visit, patients are eligible after their first 12 months of Medicare Part D enrollment. And this is separate from the Welcome to Medicare IPPE initial preventative physical exam. So we'll talk about what that is and how that relates to the initial visit as well as the subsequent visit. It's really important to point out to patients that this is not a routine physical or follow-up visit. Medicare does not cover a routine physical, and if they're confused about that or schedule a physical, then they will be billed for that. It does include a personalized prevention plan that is comprehensive, and that includes a health risk assessment. That has to be part of the first visit. And then the other key here is it is a free benefit from Medicare. There's no copay or deductible. So it is provided to all Medicare Part B patients. There's some other great ways of using this program to identify patients who would benefit from an ongoing discussion. So you may have some patients in mind who you'd like to get in on a regular basis. Now, we think that all patients who are eligible really should take advantage of this and start early with proactive care. It helps them. It also drives revenue for your business and your practice, and it also overall you'll see better results in their overall quality and the way patients start thriving with ongoing proactive care. Now, we do often start with the highest risk patients. We think the highest risk patients, that's the obvious place to begin. And so you're probably already looking at risk stratification of your population, and that just sort of happens naturally in your practice. But you can start to work from kind of high acuity down to lower acuity patients until you can really penetrate all of this. And currently nationally, there's only about a 16 to 19% penetration with annual wellness visits for patients who are eligible. So there's a lot of opportunity to improve that. You also can use the service to document diagnoses and conditions and to reflect the severity of illness. And now that plays a part in your overall reimbursement. One key here is that the COVID-19 waiver over the last 12 months, annual wellness is now included in the telemedicine waiver. So in late April of last year, Medicare waived the video requirements, and it can be telephonic only for many services, including AWV. And so, the documentation is still required regardless of how that's performed. But there's a great opportunity right now to get involved with annual wellness visits because you can do a lot of this virtually. And we do have some tools that you can use to manage that. One of them is one of our strategic partners, ExamMed. They're a company based in Atlanta, just right down the road from our offices. We've been working with them for quite some time. We both share a large client together, and so we've created a lot of integration between our platforms. They have one of the most user-friendly telehealth solutions that we've seen, very straightforward, that manages scheduling and all the workflows and patient alerts and reminders, and it's very affordable. So this is a great solution we think, to use kind of in concert with what you're already doing for annual wellness. So you may want to take a look at ExamMed, and we can make some introductions there if you're interested. So a little bit about the state of annual wellness visits. The good, as we mentioned, that it does improve patient outcomes. There's real data out there and studies that have showed that there's a statistically significant reduction in hospital acute care and outpatient services for patients who have had an annual wellness visit. Patients who received an AWV received or experienced a 5.7% reduction in the total healthcare costs over the next 11 months. So we're looking at about on average of $570 per patient in total healthcare cost savings on the whole, a net benefit to the healthcare system of $570 per year by just going to their annual wellness visit. So this is a huge initiative for our country and reducing healthcare costs and also creating better quality of life for patients. We just have to get more of them in. So as I mentioned last year, the bad is that only about 19% of all Medicare patients got an annual wellness visit that could have either improved their life or saved their life. We also run into what's sometimes called ACO cherry picking, focusing on the attributable beneficiaries within the ACO. And, we understand why that's done, but, sadly, there are a lot of patients who could benefit. They're not getting these performed because they're not part of the ACO. Also, one of the main reasons we see lack of engagement is patient apathy, and that is that we're seeing that 41%, just one stat here, 41% of all patients scheduled for an annual wellness visit fail to show up for their appointment. So there's some work to be done on education and sharing this data with them to let them know that it is super important to develop a proactive plan. The last thing here is data overload, and that's kind of where PREMEDEX has come into play in helping practices manage the massive data requirement. It may seem massive, but we have processes and we can help you. Even if you doing it internally for a small practice, it may not be overwhelming, but some of the larger practices that we work with have severe data overload, and that's just really determining which patients are eligible when they turn 65, getting them scheduled for their welcome to Medicare visit, getting their initial visit and subsequent visits scheduled. And then there's a kind of ongoing reminding and some logistics around getting all of their requirements completed. So I think that everybody here, we've talked about what it is and probably don't need to go into a lot of detail, but just a few specifics at a high level. The AWV helps us collect information about the patient, including their medical and family history, health risks, and a few specific vitals. It is intended to be a wellness visit for it to develop a personalized prevention plan. Now, patients can receive an AWV as part of a sick visit. There are also some other codes that can be built along with the AWV. So, you can look for opportunities to perform the AWV along with some other visits that the patient may be making, and they may be eligible, and you could sort of do both and bill for both at the same time. It also provides an opportunity for patients to really improve quality of care and assist with overall patient engagement. One key piece of this and a significant, something that's significant in the overall long-term health of the patient is an early cognitive impairment assessment, looking for signs of dementia and Alzheimer's and some other mood disorders that may occur as patients age. And then the provider can also order some other tests along with the AWV, depending on what they uncover. The key, again, going back to this personalized prevention plan, is to help prevent disease and disability. And there are key things that we can uncover early on with the health risk assessment that is required with each as a key component of the annual wellness visit. And that's, again, medical family history, a list of current providers, prescriptions, height, weight, blood pressure, a few other measurements, detection of that cognitive impairment, personalized health advice, a list of risk factors and treatment options, and a screening schedule. So what are patients eligible for, what screenings and shots, and sort of that becomes a key part of what you may, sort of the beginning of the chronic care management program, and opting them into remote care management and some other programs that you can use to engage patients on a monthly basis and also bill for those services. And then advanced care planning is an add-on, and there's another billable code for that. So there's a lot here that you can really benefit from a practice and revenue standpoint, but really also benefits the patient, most importantly. So the physician can bill for this, can furnish the services and bill, physician assistant, nurse practitioner, clinical nurse specialists, or other medical professionals like educators, registered dietitians, and nutrition professionals. So this is all done under direct supervision of the physician. So let's talk a little bit about coding and what you can expect from a reimbursement standpoint. There are key codes here that you need to be aware of, and you may already be billing these, but maybe there are a couple here that that you may want to be sure that you capture, that you may be missing out on. The first one is this Welcome to Medicare, IPPE. It's only eligible for the first 12 months of the patient's enrollment in Medicare. So that's a key opportunity to engage the patient, and that initial visit is not billable until a year after the patient enrolls in Medicare. So this is missed opportunity to bill for that revenue if the patient is turning 65 and eligible for Medicare. After the G0438, we move to G0439, which is the subsequent visit. Really, this is more just updating what occurred in the initial visit for subsequent years and making adjustments to those care plans. And then the advanced care planning add-on, these two CPT codes are billed in 30-minute increments. And so that's another great way to kind of boost the overall revenue when these patients are in the office. So we'll just keep moving here. And the next few slides, we'll drill down on some specifics with these codes. And then we'll talk a little bit about some of the benefits and challenges and some solutions. So the goal of the IPPE, the Welcome to Medicare, is, you know, I think we've already stated that pretty clearly. It's proactive care. It's capturing the medical and social history, the risk factors, and functional ability level of safety. There also needs to be documentation of what was discussed regarding these key items here: end of life planning, results of the findings from the review of the patient, any other preventive services. EKGs are they are covered and as part of this Welcome to Medicare. So there are a few things, additional tests that can be provided in your initial Welcome to Medicare visit and benefits to the patient that they don't get in subsequent visits. And you can lay out the appropriate screenings and preventative services for the patient. So that's just a great starting point and enrollment in sort of doing this the way it's intended to be done. The next code is the initial visit. And again, this is, there's a key eligibility for this code requirement here, that the patients are no longer within the initial 12 months of Medicare Part B coverage, and they have not received an IPP or AWV in the last 12 months. So that's, basically you're waiting until 12 months to start the initial visit with a patient. And this is a more in-depth, deeper dive on this personalized prevention plan and health risk assessment. So let's go over a few things here that are included in the HRA. So we've talked about a lot of these. I won't go back through all of them, but I think we've touched on all of these already, so I'll keep moving here. But it's basically this is a checklist of the things that we need to make sure that are completed prior to submitting this for billing.
And that's a long list there, and I think you'll get to this, but I think that's a reason in itself that a lot of the providers can't get around to it, is there is so much work to be done to check each of those bullet points off. So looking forward to kind of drilling down and hearing how that could be easier.
Absolutely.
I was wondering, is part of the pre-visit plan maybe a strategy, or that the clinician can be primed, so to speak, to just have a lot of the legwork done prior? Is that part of the strategy?
Well, I think that you stole our thunder there, Phoebe, a little bit. That, I'm just kidding, but no, that's exactly right. That is, we probably should put that at the beginning. There's a lot that can be done from a pre-visit preparation, and that's really, I think, essential to making this work. And what we've seen, practices who try this, and they have all the best intentions. They get patients in, but there's a bottleneck that occurs once the patient's in the office. They have to go through this HRA in the waiting room. Oftentimes they're filling that out. They'll ask for help at the front desk. They may have to get the nurse or doctor to assist with something as they're filling that information out. So a lot of what we're seeing, and what we're seeing that works, is that, and what we provide as a service, is getting that done prior to their arrival. A lot of this, the data abstraction from the EMR, their family history, their medications, those kinds of things, as well as the initial HRA assessment, can be done prior to the patient's arrival. So you can turn an hour-long visit into a 15 to 20-minute visit. So thank you for bringing that up. I think that was the punchline of what we're trying to get to, is that there's a great way and a great process for improving this and making it much easier. So the subsequent visit is really about updating the HRA, and it really is the same criteria as the initial, but it's very important that there's documentation that everything is covered that was reviewed in the initial visit. From an audit standpoint, you need to make sure that those boxes are checked, and we have some templates that can be used to ensure that occurs. Again, we talked a little bit about advanced care planning. Another great way to have those discussions about end of life planning, and important discussions as a patient is still relatively young and wants to make some decisions about how to handle those decisions as they age. And there are these additional CPT codes that can be billed. So we've talked about the benefits. I think the vital communication with patient and primary care physician, first and foremost, the proactive patient assessment, care planning. It's just so important to get all of this documented and discuss with the patient. I think that's really the key, is it's a key opportunity to gather that data in one plan and have a conversation with the patient about their concerns, any new symptoms, potential care gaps. Again, there's a revenue component that we don't want to overlook. There's a lot here. Medicare is incentivizing practices to do these visits, but it often seems a little daunting given the logistics, and you're already busy with the work that you're doing. So it feels like something that you can't really take on. It also improves patient experience, preventive care. You can enroll patients in these other ongoing programs. Again, that takes some logistics management, but very doable. And it also drives your quality scores. So all of these are great benefits to why you might want to consider doing more with annual wellness. Now, with that being said, there are some operational challenges. And I think we've mentioned some of these here in the last few minutes, but identifying patients during that first 12 months, getting them scheduled, telling them about the benefits that they have, and that you want to see them there in the office in their first 12 months of Medicare eligibility. That's step one. Scheduling all eligible patients. 19% on average across the country are being seen that are eligible. So what can we do to optimize the number of those visits and get more of those patients in? And that can be done with simple outreach, a letter followed up with phone calls, driving those patients, getting them to their appointments, getting them on your schedule, and finding some open slots to get them in to see you. Completing the EMR abstraction. This takes some time. And, we, as Phoebe mentioned, there's the opportunity to do that prior to arrival. And that's something that we have staff extenders who do that work for our clients and try to take that completely off their plate. So there's no work to be done up front. By the way, the work that we do is only billable after you bill for the service. So you're billing for the service prior to our bill. And then educating patients and answering questions prior to their arrival. So a lot of times patients will show up, they're confused about whether they're getting a physical, is there a copay? There could be a lot of other questions and things that they're asking the front desk that tend to bottleneck the program and create a bad experience for the office staff and the patient. You also want to reduce no-shows. With 41% of these patients not showing up for their appointments, that's a big headache for you. So you may want someone who can make sure patients are aware of the benefit and the importance of showing up and are reminded to show up, because sometimes an annual visit is it's kind of off their radar, and they need to be made aware of that as it approaches. That completing the personalized prevention plan, again, it takes a little bit of work. A lot of that can be done in advance of the visit. The physician can then review it with the patient and add those additional comments and kind of what they want specifically for the patient at the time the patient's there in the office. The length of time to complete, we've already talked about that, the disruption in the office processes. And then, this is one, enrolling patients in these additional programs. That's that's a benefit, but it can also be a challenge and can be frustrating if you're wanting to do some of these programs, but you just feel like you don't have the bandwidth to do it. So again, the best practices pre-visit planning. I think that the other part is utilizing a non-physical physician or non-clinical staff and incorporating the EHR and using that data that you have in the EHR to populate these forms prior to arrival. So one of our clients here in Atlanta, we serve practices around the Atlanta area, and we went through a process of kind of streamlining their AWV process, which included scheduling, abstraction, questionnaire, management, and the physician consultation. You can see here the time, and when we did the study, we found that on average it was taking 15 to 30 minutes of time per patient to get them on the calendar, schedule them, all of that in the front office. The abstraction would take 30 to 45 minutes, and this is abstraction of data from the EMR, family history, going through all the notes in the EHR, pulling that out and entering it into the AWV form takes some time. And then the questionnaire, getting this questionnaire in front of the patient and giving them a chance to go through all those questions, think about each question, get the information they need to answer it, and fill out those forms. That was a significant piece of this process. Is taking about 75 to 120 minutes on average per patient. And by doing a lot of this in advance of the patient arriving and doing it telephonically or through a telehealth, even now with this piece, with COVID now, there is a big opportunity to take a significant part of this process off the plate of your staff, do it up front, and then you're left with a 15 to 20 minute visit when the patient gets into the office. And what we found is that the experience is greatly enhanced with the patient. You're obviously your throughput in the office and staff staff satisfaction goes way up because they're not having to fill all these forms out and do all of this for patients prior to their arrival. They can really focus on the patient when they're there. And that helps to drive more volume, better results, and really overall better satisfaction in the program. We have some journey maps that we developed that just kind of shows these are all the things that occur on that pre-AWV assessment, the things that can be done telephonically, and what occurs during that visit once they get into the office. We also have opt-ins into chronic care management, remote patient monitoring, other ongoing check-ins. There's also principal care management. If patients only have one chronic condition, you can enroll those patients in principal care management, and there's a reimbursement for that in addition to the 2 or more chronic conditions for CCM. And remote patient monitoring only requires 1 chronic condition. So they all have a great payback. Remote monitoring, we partner with a device company, and the payback on the device is almost instantaneous within the first month or 2. The total cost of the equipment is recouped with billable codes, and then everything over that is just additional profit for the practice. So we can get in, this kind of is a little bit of a tangent from AWV, but these ongoing programs, I think that's kind of, we kind of look at everything as a part of a broader care cycle and ongoing care management. Annual wellness is just one stop along the way. between your annual wellness visit and if unfortunately a patient is entered into the hospital or goes to the ED, there are other ways for us to communicate with them and drive additional revenue during those months where you're just sort of passively reviewing some readings from the patient, looking to see if they are out of range. There are also a lot of codes here that can be generated from an annual wellness visit and or transitional care management or any other visit for that matter. But we've got a list of codes that are very suitable to remote care management or to supporting the office in a telehealth type of engagement with a patient. So I think these codes are really important to know that they're available to maximize the revenue opportunity with these patients and really help them. So that's what we had for today. We really appreciate the opportunity, Phoebe, and Brianna, we appreciate the chance to get together with you here today with your audience and share this information. We hope you found it to be helpful. And our information is here. We're located in Atlanta. We'd love to speak with you, tell you some more about our clients, what their experiences are, hear what your challenges are, and hopefully we can help you to get more annual wellness visits going. So with that, I'll go ahead and turn it back over to Phoebe. Thank you.
Well, thank you so much, Jim and Van, for sharing that information with us. It is very actionable. I was really surprised to hear that so few patients actually took advantage of this annual wellness visit, only 19% penetration for eligible patients. So that's a missed opportunity, not only for the patients, but also for the practices to really not only have that proactive approach to managing their patients, but also realizing the revenue opportunities that this presents. It's a win-win.
Right. I think that's a great point, Phoebe. It's definitely it's a two-way street. The beneficiary needs to have a desire to manage their own health, and we can't rely on that. And the provider has a duty to reach out to their patients as well. And I think the moral of the story here is there's only so many hours in the day and on the schedule. As one wise man once said, time is the greatest equalizer. Within each day, we all have the same amount. How do we use it? And that is a serious detriment to annual wellness visits. We call it visit compression. And typically the providers only schedule a few slots each week for those visits because they tend to be more in depth. Lots of paperwork, the HRAs, all of that. So a 45-minute slot is common. The rest of the world's operating on 15 and 20-minute, even 6-visit slots, right?
Right.
What we can help with and what practices should look to do is, well, how can I move a lot of the more administrative part out of the provider workflow, get that done just as you stole our thunder early on, and I'm glad you did, but get that out of the way pre-visit, knock it out, and then have quality physician time, but reduce those appointment slots back to 15 or 20 minutes. And that's where we come up with the words visit compression. So you're making more revenue in that slot. You're providing this important wellness visit, but it's not interrupting the routine of your 15 to 20 minute slots that you're used to booking. So don't be scared. You can do this and pull it off and get the win-win, as you said just now.
Yes, that's excellent. And that's what Hybrid Solutions really wants to do is, we're really wanting to help all practices realize their health, the health of the practice, and also maximize the health of their patients. And I couldn't help but think how, because I am the program manager for the quality payment program, how this would be a very good way to optimize performance on the quality and the cost component, because a proactive care plan would really help keep some patients out of the ED, which negatively, of course, impacts the cost score for a practice that is participating in the quality payment program.
No, we didn't go very deep there, but couldn't agree with you more on the benefits that the QPP, and then if you look across the payer spectrum in general, there are many incentives that they are offering because they realize the importance, and like Jim pointed out, if we can get those beneficiaries into the office for these assessments, we can prevent catch diseases in an earlier stage, but also prevent these ED visits and hospitalizations. So super key to quality.
Yes, and controlling costs across the healthcare system, as Jim mentioned. And you mentioned that other payers too incentivize
Yes,
the proactive management of patients' health.
certainly. So yeah, take a look at your payer contracts and clauses about certain numbers of annual wellness visits that you achieve within your patient population. There are also some payers that are driving their HCCs off of the mere fact of, did you in fact have that patient in for an annual wellness visit checkup this year? And that's where all of the documentation is to occur that's going to drive your level of visits for the future patient visits and encounters as well. So there's a lot being placed on annual wellness visits now.
Have you gotten any feedback from, let's say, a practice or so that this has really impacted their bottom line in a positive way, or that they missed out on something because they didn't really focus on the annual wellness visit?
Certainly. We have had comments that practices being just a handful of patients. I'm talking 12 or 15 patients short on how many annual wellness visits they should have completed in that given year to have achieved a much larger payout. I'll call it kind of a bonus payout, if you will.
Oh.
And so, really, heartbroken when you realize that from a practice revenue and health perspective, that you were that close to getting it done, but just didn't exactly maybe know where you were and push it over the line and get that extra, call it dozen patients in for assessment. That was one heartbreaking story I had with a physician themselves over lunch not too long ago.
Okay. So it's definitely worth the effort, and definitely worth setting a goal and reading those payer contracts to ensure that it gets done. We want to thank you so very much for the value you've added to our organization. We treasure the partnership with PREMEDEX very much and appreciate all the support that you've given us throughout the year in so many ways. So we also want to let our audience know that there are continuing education options available through another partner, ForMed. Excuse me. They have many offerings on their website, and through our partnership, you can actually get a 20% discount. So if you want someone in your office to become a security specialist, or if you need to do that HIPAA training that's required annually, or have someone become a MIPS specialist, a QPP MIPS specialist, all that is available through ForMed Approved. So we hope you take advantage of this offering and increase the educational opportunities, and also acquire CEs or CMEs for licensed clinical staff. So we have a few resources here that we want to share with you, other partners and other organizations that we work with. CMS, of course, Office of the National Coordinator, Department of Public Health. And we again thank you. Thank you all for taking time to participate in this webinar, and also thank our audience for registering and attending. We wish you health and prosperity, and we'll see you next time. Bye-bye.